and have chronic medical problems and are likely to do poorly with the COVID-19 infection. Our communities that are more likely to have chronic medical problems are those that have difficult access to health care, and we see that in our zip code maps, primarily in North St. Louis County. The St. Louis County has also created a high-risk task force. Some of this funding will be used, and with our high-risk task force, which responds to notice of a COVID-19 patient in a nursing home or an assisted living center, or if one of the employees of one of those facilities tests positive. And if that happens, then we send our high-risk task force immediately to make sure they have PPE, to make sure they have good procedures in place, and to test everyone who has a potential to be exposed. This is consistent with everything that's happened in my administration, which is to focus our resources where there are inequities and where there are needs. Even before we had data to demonstrate that this COVID-19 infection disproportionately affected some of our low-income communities, we created a technical advisory force, a technical advisory group in St. Louis County, and that consisted of several individuals, including Dr. Jason Purnell, who's the Director of Health Equity Works at Washington University, and he has been advising us on our response. Through this effort, we've created a regional response team coordinating our efforts with over 40 nonprofit groups and several local government jurisdictions, working together to address specific humanitarian and public health responses. Our public health department has also obtained contracts with some of our local hotels to make sure that any homeless individual who tests positive for COVID-19 can be isolated safely while they recover from this COVID-19 infection before they are placed in a homeless shelter. In addition, we have contracts with local hotels so that our first responders who test positive can be quarantined in a hotel and not return to their family and put their family at risk of being infected with COVID-19. We know that 70 to 80% of transmissions of the COVID-19 virus happen in a household from another household family member. So if we have someone who is positive and can't safely quarantine at home, we need to make arrangements for them to quarantine elsewhere. These are unprecedented times in our history. Our most recent numbers show that 58 people have lost their lives in St. Louis County. We have over 1,800 infections in St. Louis County. This is a regional challenge. This virus does not know the boundaries of St. Louis County. That's why we're working closely with all of our regional jurisdictions. That's why our public health response is coordinated regionally. That's why the St. Louis Metro Pandemic Task Force is working regionally through all of the hospital systems and reporting to us on a regular basis as well. As we heard yesterday, Dr. Garza did inform us that we are still on the rising side of the curve. We are not out of the woods. We still have a lot ahead of us. And this is not the time to let our foot off the gas or ease social distancing. We have not seen the end of this. If we ease our stay-at-home order too soon, then we could rebound and be in a much more difficult and precarious position than we are currently. Our social distancing measures are working, but we're not there yet. The federal funding is on the way, and later this week I'll be signing my request to the federal government to have our stimulus funds sent directly to St. Louis County so we can get busy with that deployment. That will be for testing, and more testing, for quarantine facilities, for humanitarian relief, and for work to restart our economy. We have already spent $7 million on PPE, and that was last week. I expect to spend millions more. We need to make sure that our public health workers, our residents in nursing homes, our employees who work in nursing homes, and our public health officials are protected and have the PPE that they need to take care of our residents. And I'd be glad to answer any questions.
Dr. Prince, do you expect, you referenced it there, do you expect to extend the stay-at-home order at some point officially this week? Could you kind of tell me where
we are currently in discussions with our regional partners, with Pandemic Task Force, with public health officials, and we will, we may have an announcement later this week, but we're currently having that discussion. I would expect from those discussions that stay-at-home order will be extended into May, but I'm not prepared to give you a specific date. We know before we can ease stay-at-home restrictions, we need to have a robust testing environment. That's why there is such an urgent need to pass these appropriation bills, to receive those federal funds, and to continue to compete aggressively in the market for testing supplies. That market is opening up just a little bit, and we want to be there fighting for St. Louis County's share of those testing supplies.
You referenced it earlier. What's your mindset about the social distancing and stay at home? You were talking about that. This is you got to stay on a full court press on this path.
That's right. Yes, and I would pay very close attention to Dr. Garza's reports. He has his finger on the pulse of the health system's response and the hospital capacity and how they are managing the sick and infected individuals who end up in hospitals. Our health systems cannot control where this virus goes. That's up to us. They can treat people who are sick. And we need to make it as easy as possible for them to treat people who are sick. And that means doing everything possible we can to limit the spread of this virus in our community, because this is an infection that does not have an effective treatment. It does not have a vaccine. And we are limited to epidemic management techniques, which are test, isolate, and quarantine close contacts. And we are currently living in a national environment where testing is very difficult. We don't have enough testing supplies.
A couple of questions, Dr. Page. Going to the fact that minority communities are impacted the most by COVID-19, there's been studies elsewhere in the country that workforces of exempted essential workforces, so grocery stores, public transportation, janitors, and the like, have large minority workforces. So because of that, and because of many of these workforces are putting themselves in harm's way because they're so important, is it the government's responsibility to provide those essential workers beyond the medical field with PPE and other things so that they don't get sick?
Right, so we certainly have worked with our grocery stores to help protect our grocery workers, and I do believe that they deserve PPE as well, and we've gotten there. And initially we had very little PPE. We barely had enough PPE for the doctors and nurses in the hospitals. I hate to stratify who's most essential. I don't want to get into that argument, but we do have a lot of people who are in constant contact and constant risk with individuals, and that's why it's so important that we all wear a cloth mask when we're out in an area where social distancing might be difficult, such as a grocery store, and that helps protect our grocery workers. The cloth masks are more about protecting someone from transmitting COVID-19 rather than receiving COVID-19. There are higher grade masks that our grocery workers have now, and I believe the plexiglass panels that were installed by the grocery stores have had an impact as well.
My second question relates to other disasters. There were major tornadoes in the South this weekend, and I wanted to ask you how prepared St. Louis County is if there's a flood, a tornado, even like an earthquake in St. Louis at the same time coronavirus is going on. Is there going to be enough resources and enough focus for the county to handle both coronavirus and a natural disaster?
Well, certainly anytime you have two disasters at the same time, it becomes challenging. We have a state-of-the-art emergency operations facility. They watch the weather alerts. We watch the weather very closely. We're tracking all of that, and if we have a natural disaster on top of this disaster, then we'll find a path through it. It certainly will be difficult. Two natural disasters, two tornadoes right on top of each other, which we've seen before. Other types of disasters together are challenging. But we will manage our way through. We're lucky in St. Louis County that we made an investment almost a decade ago, and we have a very strong and robust emergency operations center, and work very well with our first responders and all affected parties.
In your opinion, do you think we'll be out of the woods, say, by July?
This is going to go on for a long time. The question is, what does it look like? How much can we ease social distancing? How much, what sort of testing environment can we have? Because it really does depend on the testing environment. As a country, can we produce enough tests for both types of tests? We need tests. We need serologic tests to determine who has immunity, and that's a different test than the PCR test, which will tell us who is acutely infected, who has the virus load on them right now. We need both of those tests so we can determine immunity and we can understand what the prevalence of COVID-19 is in the population, because we know many, many people have had this and have been asymptomatic or have mild symptoms, and we don't know everyone who has had this infection.
Dr. Page, what about parks in St. Louis County? If you were to extend the stay-at-home order into May, I think that a lot of people are probably anticipating that announcement to come at some point, but are starting to think, oh my goodness, if the weather warms up and all of the parks are still closed and this continues to go on, is that something you might reassess?
Well, we're looking at all of our stay-at-home orders, and every one of them are frustrating. Closing businesses, limiting crowd sizes, eventually the stay-at-home orders, closing parks, all of these are extraordinarily frustrating depending on who cares the most about which part is closed. Closing parks is very, very frustrating to me. We just could not manage the overwhelming crowds. We could not provide enough park rangers to break up the crowds. And then when the state closed their parks, we saw a second surge into county parks. And then our Google Analytics demonstrated that our parks were becoming extraordinarily crowded. But if we can find a pathway to open some of our trails at some point, if we have enough park rangers to monitor that, then that's something I would consider down the road. But we also have park rangers who are recovering from COVID-19, and some of them have been diverted to help with some of the first responder duties and security duties. So there's several factors that go into that. We're all extraordinarily frustrated by every aspect of the social distancing, including the closing of the parks. Our top priority is going to continue to be saving lives and getting through this as quickly as possible.
And then in terms of recovering patients, is there a specific time when recovering patients are allowed to leave the house? And is there any guidance from the county? Are you guys in touch with them to make sure that there's no confusion?
Our county tracks everyone who is COVID-19 positive very closely and provides them with advice. Someone is in contact with them on a daily basis to provide advice, or available on a daily basis. Many of them are communicating through telemedicine. In addition, our county government has a very active contact tracing program, and that's one of the issues that's discussed most at the federal level right now, is massive infusion and massive investment in our public health community nationwide to provide more people for contact tracing. That's a very important part of the testing piece. Test, isolate, trace contacts, and quarantine people who might be at risk, or at least provide them with advice.
As a follow-up to the question about the county parks, with the request by some council members to reopen the parks, I'm assuming by hearing you say that's not an option in your mind at this point?
No, we're not talking about opening the county parks today.
Okay. And also, what's the latest with the temporary morgue set up in Earth City?
I believe that structure will be offered to the media for a tour either later this week or early next week. That facility will be available because one of St. Louis County's duties and responsibility is to provide medical examiner services, not just for St. Louis County, but we have a cooperative relationship with all of our surrounding jurisdictions to provide those services. And we know that when we have at risk for extensive loss of life, as the COVID-19 virus does, and we need to be prepared for that. I believe the impact here will be much less than what we see in other communities in our country because of the aggressive actions that we took early, but we do need to be prepared for that, and we will. We'll do it with dignity and with sensitivity to allow the families to grieve consistent with their faith.
You think it'll be open will be able to be open by Friday if need, or when do you think that'll be open and available?
Yeah, I don't know that answer.
Okay.
It'll be open when it's needed. I don't think we're there yet.
From looking at the $7 million request, the bill that was sent to me, there's $2.5 million for a population health study. Can you elaborate what exactly that's meant for? Because I think that's the biggest item in that $7 million request.
Yeah, well, we'll be buying a lot of tests, and we'll be buying a lot of PPE, and those numbers will be extraordinary and impressive. A population health study is when a population or a group of individuals or community is tested to determine how many people are positive in that community. And that's one way to get an estimate of the burden of COVID-19 in your community when you don't have enough tests to test everyone. So it helps us in mapping our pathway to easing social distancing restrictions to know what the prevalence of COVID-19 is in your community. It's a very common public health technique, and it's very important for us to know what percentage of our community is infected, because we can't test everyone with symptoms, and we know that maybe 25 or 30% of folks who have COVID-19 infection don't even ever show symptoms. So we need to understand what that number is. That gives us an estimate of the immunity, which helps us manage our social distancing restrictions. The CDC is currently working on guidelines on a reopening guideline for our country, and we're going to watch those guidelines very closely, and that will be part of what we work into our decision-making structure.
So the $2.5 million is not only for the people that analyze the data, but it's also for all the testing equipment to test.
Yeah, this is almost entirely for tests.
Yeah.
Yeah, it's not to pay people to talk about the tests. This is for services to our community.
For testing and some PPE, including that $7 million too, or?
Yeah, some of that $7 million will be for PPE, and we'll be buying more PPE. We'll be buying PPE. We buy PPE every day, anywhere we can get it, as much as we can get. We try to stay 30 days ahead, and we watch the consumption trends. We know that we're still on the upslope of the curve, and we try to predict how the consumption will increase. And right now, we're doing everything we can to conserve PPE. We have some conservation techniques in our hospitals and with our first responders to make sure we're doing everything possible to go through that in a responsible way.
Hey, Dr. Page, we have a question from KMOX about the National Guard. Have you talked to the governor about that, and what will their role be? Are they here in the community?
Yeah, the National Guard is not here for any sort of police or enforcement action. They're here to help some of our medical personnel to support the hospital, the overflow facility, and the hotel in Florissant. They're here to transport equipment and patients, and they're here to help provide extra security at hospitals because they will have extra patients. They will be above their regular capacity, and the hospital does have some security personnel, but they certainly don't have enough. If their capacity is increased by 50%, it's good to have some extra people around. And they're not here to get involved in social distancing restrictions or anything like that. I think we have about 50 National Guard here, and some of the things they're doing are supporting our testing facilities, and I even think they sent some medical personnel to perform some of those tests, so the nurses that were doing that testing can go back and help at the hospital.
You mentioned not enough park rangers. Would it be a legitimate question to bring in the National Guard just to monitor the parks, then to let people back into them?
I'm not sure that I could get National Guards to monitor social distancing in parks. I really don't want to put the National Guard in a police action to break up crowds or enforce social distancing policies. For the most part in our community, I think our residents understand the importance of social distancing. They've gotten the message that this is how we get out of this, this is how the world has managed this is how the country has managed this. If we can comply with social distancing and be patient, we can get through this and we can have a smooth landing and a smooth recovery. If we have a rebound, it will be a very rough landing and it will be a very rough recovery, and the economic impact will be much more complex and unpredictable.
St. Louis County is obviously one of the more populated areas within Missouri. You know, it's a very different picture if you were to go to some of the more rural areas in Missouri right now in terms of how the virus is affecting those. As we start to discuss, you know, reopening the economy, reopening our state, I know that you said you're going to be following those CDC guidelines, but how do you anticipate managing any problems that may arise from things in the state being able to reopen at different times? I mean, we even saw that from St. Charles County to St. Louis County in terms of the stay-at-home orders.
It's much better if we can hang together on those reopening decisions. In fact, if you look what's happening on the East Coast and West Coast, entire states are making reopening decisions together, and I would hope that our region can make those decisions together as much as possible. We recognize that some rural areas and rural communities have social distancing by definition because they're rural. But we also have to recognize that there are common gathering places, whether it's a restaurant or somewhere else, where this disease can spread very quickly. And if restaurants are open 20 minutes away in a less populated community, I'm sure that residents in St. Louis County will find that less populated community and will be there. And it's very important that we respect our social distancing measures moving forward, that we patiently work our way through these next few weeks, and when we reopen the economy, we have the right plan in place, that we can test aggressively, that we can isolate and quarantine and follow all these public health strategies that we know that work. If we are not responsible with our social distancing measures and our decisions about reopening, then we will have a very rough bounce, and we are at risk for a rebound that is much more problematic than we currently have. We need to give time for our health systems to recover. We need to give them time to resupply. We need to give them time for their doctors and nurses who have been infected with COVID-19 to recover and get back in the workforce. And we cannot have a rebound that is not well managed or well controlled.
Didn't the governor basically force a lot of people's hand by closing the schools until the end of May? So even if there are social distancing restrictions eased, for a lot of families, it's not going to really be possible to leave the house because of that. So aren't we kind of going to be in a de facto social distancing situation until like Memorial Day for a lot of people, especially with families, like with small children?
Yes, so stay-at-home orders and social distancing certainly are on a spectrum, and how we move that spectrum along and where we land on that spectrum of partial opening is a conversation we're going to have. So when we talk about ending the stay-at-home order, we also talk about what partial opening looks like, and I want to map that out with our public health professionals, our hospital systems, get some guidance from the CDC, and be very thoughtful about it, because if we make that decision in the wrong way, the rebound will be very unmanageable, and we'll be in a much worse position than we are now. We're in a good position now, and if we continue to make good decisions, then we can have a smooth landing. If we make the wrong move, then this can come back very quickly and be very much unmanageable.
Is that all?
Okay.
Thank you all.
Thank you.
Thank you.
Thank you.